Hi, today we're going to talk about the RTI model. And the RTI model stands for Response to Intervention Model. It is an educational approach designed to provide early and systematic support to students who are struggling academically and behaviorally. It's a multi-tiered system of supports that aims to identify issues early and deliver targeted interventions to help students succeed in the general education setting. Okay, so that's before you even decide to start other services. You should be following the RTI model, the response to intervention. Okay, there's 3 tiers that we're going to discuss today about what you could do to start as a whole class and then smaller groups as you go up the pyramid. Okay, we're going to talk about a pyramid. By focusing on high quality instruction, you'll be able to do your best teaching, right? You're gonna do universal screening to see how everybody is doing, and you're gonna use data to drive your decision making. All right. This model promotes inclusive education and reduces the need for special education placements, because if you're doing the right things, then you won't be it's less likely, you're less likely to have to say, wow, this student is not following along. This student might have, a disability or, a cognitive, delay or and so on and so forth, versus analyzing your own teaching and trying to see, wow, maybe I'm not providing all the supports. Let's try to do those things instead, those particular things instead, those strategies, and then go from there. Okay. Key components of the RTI model. High quality instruction is number 1. All students receive research-based, effective teaching in their general education classroom. So an example would be using the AVID, method, or, have GLAD classrooms, the guided language acquisition design model, embedded within the classroom, or using, strong curriculum practices into that particular classroom. If, let's say, it's a dual language program, the teacher is knowledgeable about how to go, from English to Spanish and Spanish to English, or Russian, Ukrainian to English, and vice versa, or any language that it might be, right? So making sure that you have that high quality instruction going on. So that's number 1. 2, do the universal screening. So regular assessments conducted to identify students who may be at risk of poor learning outcomes. So you need to know how students are performing, so you know where the gaps are. If they are not doing well, how do you know they're not doing well? So you must be doing something to know that information, right? So assessing them regularly in many different ways. So assessment can be done, I would say, systematically. And I would also say assessment should be done creatively and authentically, right? So when we're talking about diverse learners, I would say you should include the 4 domains of language: the reading, listening, reading, and writing, and making sure that you're giving them the opportunities to show all they know in all those domains, okay? That way you have a clear picture of how they're performing, especially if they are trying to show content knowledge and they're having difficulties with developing their language. They're needing help with the language development as well. So don't get content development and language development confused when you're assessing. Try to look at those two, together. Look at the child as a whole child, right? That's very important. Then the third one is continuous progress monitoring. So don't just evaluate them a little bit. Start there. Do a pre-assessment. Do like your first unit, assessment. Then continue to monitor that student throughout. So continuously, right? Ensure that they are making adequate gains. Don't just stop, oh yeah, they're doing better, and then you just forget about the student. I know you have a lot of students in your room that you're like, okay, I'm worried about this one and this one and this one. So you should have systems in place, even if it's just sticky notes with their names and you have them on a little chart for yourself inside a little folder, right? Track them somehow, that in a way that it will be easy for you to see visually. You can be like, oh, okay, I need to move this student from here, from this area of my, assessment chart to this area right here, maybe a higher level of reading or math or whatever you have inside that little folder, right? How are you assessing them in an ongoing manner? And how are you defining success? Okay, are you using rubrics? What kind of assessments are you using? Are those assessments fair? Rethink your process in your teaching. Then the next one is tiered intervention. So another key component of RTI model is we'll call the tiered intervention. So interventions are provided at increasing levels of intensity based on individual student needs. So you would start by having the tier 1, everybody gets the same in the classroom. High quality instruction, you're assessing them, you know where the problems are, you know what you're doing. Then you would go level tier 2, right? A smaller group, target some more that you're going to think about particular standards they're not meeting and teaching them to that standard or skill that they need to learn. And then from there, then you would have your tier 3 group that would be very individualized, maybe pairs or one student, very tiny groups, right? And that would be very targeted, individualized work with them, right? And that is in the general ed classroom. We're not talking about special education where you would pull the student out and do that. This is all inclusive, okay? And then we have the data-based decision-making is what I just told you this whole time. You're not going to base your decisions on just whatever random, decision you're making in your head. No, everything's based on data, on the assessments you've been giving the student, on your observations of that student, on your perceptions as well, right? I feel like teaching is an art, right? That's the art of being a teacher, is observing the student, making decisions based on how you feel the student is doing is really important, right? Absolutely. I feel like you can make a decision based on how you feel, but also make sure that you have that data to back you up. So you know the student very well. You're there with that student every day. There's nobody that knows that student more than you. Absolutely. But the data will help you so much in making sure that you are giving that student the exact thing that they need based on that assessment you already gave him or her. Okay? Your opinion counts. Absolutely. And you should always count because you're the professional. Is the art in teaching, is being that human being that is compassionate, flexible, organized, and that gets the work done, that has, that end in mind, that has that learning, in mind for that particular student, that teaching of that skill that you have been planning on doing for this whole time, right? Now, what are the 3 tiers of the RTI model? Here is a little bit more information. So tier 1, universal intervention. So like I said, the whole class gets this. So all students receive high quality, evidence-based instruction in the general classroom. Universal screening is used to identify students who may need additional support, and progress monitoring is conducted to ensure all students are making adequate progress. That can be done through like a classroom-wide or school-wide assessment. For example, STAR assessments could be an example. Everybody gets, has that assessment done once a month, and it takes about 20 minutes. And then that will give you some information about the student and all the skills and standards for that particular grade. And then you can compare and contrast all the things that they know and don't know and should know. Okay, that's an example. But with that information, you will teach them all high quality instruction, right? All the entire class. Tier 2, excuse me, targeted group interventions would be smaller groups. So students identified as at risk through screening receive more targeted small group interventions. These supplementary interventions are more focused and intensive than tier 1, with more frequent progress monitoring to evaluate their effectiveness. So you might want to have a peer educator come in if you have that option. And the peer educator will serve as a teacher to the students that don't need the extra support. And you, as the teacher, you will provide the tier 2 group intervention support because you are the professional that has gone to school for so many years. You know what they need more. So you're going to let the paraeducator run another little small group or an activity that they are doing as a whole class. You're going to pull your small group off to the side, your tier 2 group, and you're going to work on that skill with them bravely, right? That's how you do it. Tier 3, the word says it right there, intensive individualized intervention. Students who do not respond adequately to tier 2. So you've tried tier 1, whole class, tier 2, small group, now tier 3. They will receive highly customized one-on-one support. Maybe group of 2, let's say you have a pair. Maybe they work well together. Maybe they need the exact same thing, but I would say maybe just one, right? At this level, consideration may be given to a special education evaluation to determine if the student qualifies for special education services or not. But again, that might be, each case is a case. The student might not need that, but it might just be a matter of working on skills that were left behind years ago, years before that, years prior. There was no foundation of that particular skill, like the student didn't catch that knowledge. Wasn't able to particularly learn that knowledge. So maybe sometimes it just takes a little longer. It doesn't necessarily mean that that particular student needs special education services. So you just need to be careful. Also be careful with student having difficulty learning language and student needing to be referred to special education, because having to learn a new language takes 5 to 7 years. Don't forget that. And then saying, oh yeah, I'm going to just refer that student to special education. Well, is this a language development, issue? I'm going to call it issue, but it's not an issue. A language development topic like that where you have to discuss, or is it a cognitive delay? See how those two things are different? So be aware that those things might happen. Okay, then you're going to be the one suggesting those, accommodations for students and interventions. And then, what happens next is going to be up to you to suggest to your principal, to the team of special education professionals. Okay. So it would be your psychologist, psychology team, like, like there will also be like, so the counselor at your school, there will be so your principal there or vice principal, you, another teacher that the student might be a PE teacher or art teacher, another teacher that sees the student constantly, and the psych team that will be there with you. Okay, so then together collectively, then they would be referring the student to special education if that's the case. But just be careful, sometimes it might just be a skill that hasn't been developed yet. Okay, and to wrap up our topics today here, why is it cool to have the RTI model in your school? What are the benefits of the RTI model? So early identification and support is number one. So it helps you identify students early, because if students are learning, they're not behaving poorly. If they feel successful, they're not behaving poorly for the most part, right? So if they're bored, it means that they're not, either they already know the concept or they can't learn the concept because it's too difficult. So they check out. So they're bored. So if you're having behavior trouble, it's because they're not willing to learn. So if you identify them, the students that are having trouble learning right away, you're going to get that behavior nice and smooth. They're not going to have any behavior issues. So first, identify them. 2, another benefit of the RTI model, it's data-driven. It's how you decide what happens to the students. So it's not just because somebody said so or because you're just feeling it. No, you know the student, of course. Your opinion matters, yes. But it's data-driven decision-making. That is ensuring that you're going to continue to monitor that student. You monitored in the beginning, you identified, then you can start to monitor all the way through and provide the supports that the student needs. It might shift also, right? Depending on what the data is going to give you. Number 3, it's an inclusive approach. The RTI model focuses on providing support within the general education classroom, reducing the need for special education services or placements, right? Promoting inclusive education. That's very important. Every time that there's a pullout, the pullout model is the least effective model there is. Collier and Thomas research shows that the least effective for somebody learning a language, for example, is the pull-out model. When you pull them out and you teach them a language separately, it would be the same as like pulling somebody out to teach them a separate concept, no matter what, subject it is. Could be math, could be science, could be anything, because they're not with the class and they're missing out on that other content. So you pull them out, they're learning something that they're like kind of behind on already. But then when they come back into the room, they're behind on that particular concept that the class was learning as well. So then they're behind here, and they're also not experts in what they were behind on because it was not enough time. Because usually it's a quick pull out, right? 15, 20 minutes, 30 minutes if they're lucky, once a week, twice a week if you're lucky, right? So just think about that. And four, the RTI model provides a flexible and adaptive way of doing interventions. So the RTI model allows for adjustments in the intensity, types of interventions that you're going to do based on individual student response. So how they're responding to your intervention, how you're teaching the lesson. The lesson might be going one way, and then the student's like, oh, I already know that. So okay. So you don't need to be teaching the same thing. So you can like stop teaching that particular concept and then either going more advanced or teaching the next concept that you need to teach that student right away. So you tailor the content and the concepts to the student's needs. So it's flexible and adaptive. I love that. So it ensures that students receive the support they need to succeed. So based on all this that I told you, I would say the RTI model is pretty amazing. It's such an easy thing to think about, but why don't we do more of this, right? So that could be something to think about if you're a school or that you've been involved with or have worked at. You don't do that yet. I doubt it, but there's always something that you can bring up. Oh yeah, I was thinking, how about we do the RTI model? You can always bring it up if it's not being done or reinforced. It's such a simple way to think about education, but at the same time, sometimes there's so many other things thrown at us in education. It's like, oh, we forgot about this simple way of doing this. This is like basic, right? But is it? All right. I love that you stopped by and were able to see this lesson with me and learn a little bit more about this RTI model. And I'll see you next time. Okay? I'll see you during our next session. Thank you very much.